Getting health professionals to work effectively together to provide high-quality, person-centered care has been a long-standing problem and continues to be a challenge within health services. The purpose of my brief is to discuss why it is essential that health professionals foster skills in working in groups and teams. How can this be such a hard task to do when people are born into groups called families and interact with different types of groups throughout all stages of their life? Well, this depends on many contributing factors that will be discussed throughout my speech, including the phases of a group's life cycle, functional roles of each group member, and the issues and possible strategies in group functioning. I'll also discuss and give examples of the types of groups and teams we as health professionals will work in, and what the required skills are for a team to function successfully. Firstly, you must understand the definition of a group or team. According to Portsmouth, Coyle and Treed, a team is a group of people who work together interdependently, commonly employing a shared set of rules, guidelines, or professional ethics. Ideally, health practitioners work in a collaborative team in order to optimize health outcomes, taking into account multiple aspects of a client's requirements and balancing practitioner needs with the complexity of services provided. This means healthcare professionals will work together with multiple professionals from a range of different healthcare backgrounds to achieve a common goal of person-centered care and improving health outcomes. A successful group will have respect, trust, honesty, open communication, a shared environment, and be collaborative. Whereas an unsuccessful group will show a lack of respect, lack of open communication, and dishonesty. The structure and development of the group is defined by the life cycle of the group. The further a group progresses, the more familiar they will be with each other, developing strong working relationships. Tuckman and Jensen are theorists who suggest the life cycle of a group happens in 5 stages: forming, storming, norming, performing, and mourning. Forming is the first stage, when the group is first established and members experience caution and excitement as they get to know one another and explore the boundaries of acceptable behaviour. Members have a desire to be accepted and begin to gain an understanding of the group's purpose. Next is storming, where conflict for the task and/or power struggles may arise. Not all groups will get past this stage, as there may be resistance to cohesion, interpersonal issues, and different ideas. Norming is the third stage, where members understand and accept the group norms. There is a sense of mutual support and cohesion. As well as focusing on the group's purpose and goals, there is also acknowledgement of talents during this stage. The fourth stage is performing, as the group performs most effectively together, developing strong working relationships with one another. During this stage, you may witness trust, respect, a mutual understanding, high morale, and loyalty. The final stage is mourning. The team members have completed the task and celebrate and congratulate one another before saying goodbye. Members are proud of their achievements within the group, but have a sense of loss due to farewell and separation. For communication to be effective, it requires an understanding of the group's dynamics and group goals. Each member will bring different personal traits to a group and adopt different roles within that group. Different roles can be either positive or negatively impacting the way in which the group functions. Some of these roles include, but are not limited to, the encourager, the blocker, the critique, and the joker. The critique is a positive member in the team as they constructively analyse the group's accomplishments. The encourager is also a positive member to the team as they praise, agree with, and accept the contributions of others. The blocker, on the other hand, is a negative member in the group. They will interfere with progress, rejecting ideas, and refusing to cooperate. The joker can have a positive impact as they relax group members with jokes. However, if they choose not to focus or take anything seriously and collaborate with the group, they will have a negative impact on the group. The negative attributes pertaining to a group member, such as the blocker or the joker, can become common problems in the group. Each member will have an effect on the group dynamics based on their motivation for participating, similarity to other group members, level of maturity, and ability to appropriately express ideas and feelings. Some issues may include unconstructive, not participating, individual team, talking over one another, and dominating conversation. A common problem seen with the joker could be they are unconstructive and don't want to participate. A solution to this could be finding the reason for their behaviour and work around it and with them to promote participation in a way that accepts their personality. In order to achieve the common goal, the team must work collaboratively. Sometimes teams may need refocusing or time frames and set rules to motivate them to progress towards the common goal. Other times, teams may be all working to achieve a common goal, but working individually to reach it. Situations where people are talking over one another and trying to dominate the conversation are examples of ineffective teamwork. Here, the concept of teamwork needs to be reiterated and brought back into focus. Some more possible strategies may include promote participation, refocus, set rules, set timeframes, reiterate the purpose of teamwork, and leadership. A leader is often useful in situations like this to remove behaviours like talking over one another and reinstate the purpose the team is working together. Good leaders are characterised by the possession of common sense, organisational knowledge and skills, an ability to see the big picture, excellent communication skills, and people skills. Many health professionals will at some point lead multidisciplinary teams. From the patient's perspective, it is essential health professionals collaborate and work well together, considering the client's needs. The composition of a health team is solely dependent on the patient's needs and requirements. A multidisciplinary team is a good example of a healthcare team in a hospital setting. Chester and Webster suggest a multidisciplinary team utilises the skills and experience of individuals from different disciplines, with each discipline approaching the patient from their own perspective. Separate assessment, planning, and provision with varying degrees of coordination. Essentially, health professionals will work in conjunction with each other but act autonomously. To put it in simple words, a multidisciplinary team is when different types of health professionals work side by side to achieve a common goal, that being person-centered care. Depending on the patient and the situation, health teams include a variety of different professionals who are vital to the health outcome of the patient. For example, a patient who is receiving rehabilitation after knee reconstruction will be associated with different health professionals, including rehab nurses, GPs, physios, allied health assistants, and pharmacists. For the rehabilitation to be successful, the multidisciplinary team needs to have structures in place that support the outcome. These include screening and handover prior to arrival, timely assessment, client involved in goal setting, review and discharge planning, weekly multidisciplinary team meetings, combined therapy sessions, family conference, and links back into the community services. To maximise the effectiveness of a functioning team, it requires skills. This may take time, and some members may need training to acquire appropriate skills needed. Team members must display effective communication skills such as effective listening, verbal and non-verbal communication, and respect and empathy. Each member must trust and respect colleagues, team members, and themselves. Trust occurs when a person is confident in the actions of another person, and respect occurs when the member shows honour or regard towards one another. Be cooperative rather than competitive. You are working towards the same goal. There is no reason to compete. Communicate openly whilst suspending judgment, and be ready to applaud the work of others. It is essential that health professionals foster skills for working in groups or teams, as the care of a patient will predominantly require more than just yourself. Health practitioners tend to work in collaborative teams employing a shared set of rules in order to optimize the patient's health outcome. The further the group progresses through the 5 stages of the group's life cycle, the better the group's outcome will be as a collaborative team. Remember, each member of the team will bring different personal traits and adopt different roles within that group. Understand the types of members you may face, including the joker and the blocker, to eliminate possible issues and create strategies to solve problems you may encounter. Depending on the patient and the situation, health teams include a variety of different professions. This type of team is a multidisciplinary team. It is the most common team you will come across in the hospital setting. Always remember to maximize the effectiveness of a functioning team, you will require skills such as effective listening and respect and empathy. Keep patient-centered care your focus and work collaboratively together in your team to achieve a positive health outcome for the patient.